start sparsing the mics down a little.
Okay.
Good morning, everybody. I want to call this meeting of the House Health Committee to order and ask Devin if he would please take the roll.
Chair Frankel,
Here?
Representative Benham, Borowski,
Designation?
Boyd, Hambidge,
Designation?
Howard,
Designation?
Khan, Gazarovski,
Here.
Krajewski. Mays.
Designation.
For Lawton,
Designation.
Sanchez.
Designation.
Schusterman. Venkat.
Here.
Chair Rapp.
Here.
Representative Bonner. Borowitz.
Designation.
Brown.
Designation.
Day. Krupa. Roy. Rossi. Stare. Twardzik.
Designation.
Present, remote.
Oh, sorry, Tim. Representative, I'm sorry.
Walsh.
Designation.
Zimmerman.
Designation.
We have a quorum.
Thank you, members. First item on our agenda this morning is House Bill 69. I move that we consider House Bill 69. Is there a second? Chair Rapp seconds. Representative Cutler is the prime sponsor of House Bill 69. Mike, would you please describe the bill?
Thank you, Mr. Chairman. House Bill 69 will expand the Cancer Drug Repository Program, Act 14 of 2008, into a prescription drug repository program. Under this bill, the State Board of Pharmacy will be required to establish the program to allow unused prescription drugs to be redispensed to patients who are indigent by pharmacies approved by the Pharmacy Board. Participation in the program will be voluntary.
Thank you. I have a amendment that I'm offering, A00299. Is there a second to the amendment? Second by Representative Khan. This amendment changes the time limit on temporary regulations to 3 years and adds in clarifying language to ensure liability protections that correspond with existing law. Is there any discussion on the amendment? I believe it is agreed to by the prime sponsor. Any discussion? Are there any negative votes on the amendment? Hearing none, Amendment A00299 is amended into the bill. Representative Cutler, would you like to talk about your bill as it is amended?
Thank you, Mr. Chairman. Thank you, Madam Chair. Members of the committee, I want to thank you for pulling this bill up for consideration again. Very briefly, this bill really was born out of a constituent meeting. Mr. Hess had come to me after his wife had passed away, and he had a whole host of not just cancer drugs, which was her main diagnosis, but also non-cancer drugs that were very expensive. Ultimately, he was told to waste all of those. It turns out that the current program, there's only about 2 pharmacies that are enrolled in the current program that would do this. So as we look to figure out why, and talking to many of the members, we look to both broaden the scope and the opportunity for individuals and families who may have lost loved ones, an opportunity to take something from their experience and their loss and then pass it on to someone else. I think we all recognize the increasing cost of health care and some of the challenges that are there. And I want to thank the members for your affirmative vote and thank the chairs for their work on the amendment. That was in consultation with some of the stakeholders and making it consistent across the board. Certainly would be happy to answer any questions about the underlying bill as amended, but would look forward and ask for your support.
Thank you, Chair Cutler. Are there any questions, any discussion from members? Seeing none, let me turn it over to Chair Rapp.
Thank you, Mr. Chairman, and congratulations, Representative Cutler. This is a good bill, and I'm certainly in favor and will be supporting your bill, and I'm asking my members to do so as well. I do believe this is a good bill. It allows individuals to donate unused prescription drugs, and it will hopefully increase participation in the program by pharmacies, as right now we only have 2. So there's also reporting requirements, and so I ask again of my colleagues that you support this bill. So thank you, Mr. Chairman, and congratulations.
Thank you, Madam Chair. I suspect that Chair Cutler and I read the same news stories last year related to the problems around the Cancer Drug Repository. News reports showed that despite enabling legislation, the program basically isn't operational in Pennsylvania, even while other states have found a way to make it work. I want to thank him for his work on this bill and attempts to both save waste in the system and supporting struggling families. I move that we report House Bill 69 as amended. Is there a second? Second by Representative Rossi. Are there any negative votes on House Bill 69? Seeing none, House Bill 69 is reported unanimously out of the House Health Committee. Thank you, Chair Cutler, and congratulations.
Thank you,
Thank
Mr.
you,
Chairman,
members.
Madam Chair, and members of the committee.
Next on the agenda was House Bill 65, and with the agreement of Representative Howard, we are going to go over House Bill 65. Although this bill passed during the last cycle and has been up for consideration for several months, we've had 11th hour feedback that came so late that it's impossible to respond thoughtfully. Therefore, we will not be able to consider House Bill 65 this morning. House Bill 79 is the next on the agenda. I move that we consider House Bill 79, sponsored by Representative Venkat. Is there a second? Seconded by Representative Krajewski. Erica, could you please explain the bill?
House Bill 79 creates a medical debt relief program for the purchasing of medical debt and creates transparency guidelines for charity care programs.
I move that we consider Amendment A00328 offered by Representative Venkat. Is there a second? Second by Representative Kozarowski. Erica, will you explain the amendment?
Amendment A00328 renames the bill the Hospital-Based Financial Assistance Act. The amendment removes the medical debt relief program entirely and focuses on ensuring patients have information about current charity care guidelines for existing hospital charity care programs. Hospitals are not required to start or adjust their charity program eligibility requirements. Rather, the amendment makes it simpler for patients to understand programs that hospitals offer now. The amendment provides 180 days for the Department of Health to consult with hospitals and the public to create standardized forms for charity care programs, including a uniform application, a template to summarize eligibility information, and uniform statements related to the availability of assistance and the application for assistance. Standard forms must be posted online and be provided to patients in intake and discharge materials and on bills and billing statements. Hospitals must provide charity care eligibility information to the Department of Health. Patients are not liable for hospital bills until a hospital has determined if the patient is eligible for charity care.
Any discussion on the amendment? On the yes, Chair Rapp.
Thank you, Mr. Chairman. I believe this amendment is a common sense approach to the very real issue of medical expenses. It is important for patients to understand financial assistance policies and to have one place where they can go to see a hospital's charity care program. And specifically for nonprofit hospitals, the IRS rules require a hospital to have a financial assistance policy. Included in these federal rules are requirements that the financial assistance policy apply to all emergencies and other medically necessary care provided by a hospital facility, and a requirement that the policy must be widely publicized. I believe this amendment will further the IRS requirements. Therefore, I will be supporting it and will be asking my members to support it as well, if you feel that you can. And so thank you, Mr. Chairman.
Thank you, Chair Rapp. Are there any negative votes on the amendment A00328? Seeing none, amendment A00328 is adopted into House Bill 79. Representative Venkat, would you like to speak on the bill as it is amended?
Yes. Thank you, Chair Frankel, Chair Rapp, members of the committee. As you know, as everyone here knows, I've been working with colleagues across the aisle on this issue of medical expenses, medical debt, and transparency to patients. I would echo the comments from Chair Rapp that I believe this is a common sense, carefully crafted method to make sure that all of our constituents understand the costs that can be associated with healthcare, that can access existing hospital financial assistance policies, and to make sure that that is systematically transparent to patients and to the public. I also think this is a benefit to hospitals. I think too often hospitals are wrongly accused of somehow hiding these policies. I think it's a matter of bureaucracy that these policies are not as apparent to providers and patients as they would be with this type of legislative action. I would just conclude by thanking my co-prime sponsors, and especially three who are here on the committee today, Representative Khan, Representative Kozorowski, and Representative Twardzik, who've really worked together along with the others who have prime sponsored this bill to get us to this point, and I would humbly ask for everyone's support.
Thank you, Representative Venkat. Other comments, discussion? Chair Rapp?
Run the bill. Thank you, Mr. Chairman, and thank you, Representative Venkat, for your work on this bill. There are many emotional and physical tolls that an individual can go through, both as a patient in a hospital and after they're discharged. Patients should have information readily available to them regarding financial assistance policies, and this bill may provide one less thing for a patient to worry about. I'll be supporting this bill out of committee, so thank you, Mr. Chairman, and thank you, Representative Venkat.
Thank you, Madam Chair. Thanks so much for your ongoing work on this bill, Representative Venkat. We look forward to, we looked at this last cycle, and it was alarming to realize that many individuals identified as having medical debt would have qualified for charity care programs. This legislation is a good step connecting patients to charity care. I move to report House Bill 79 is amended. Is there a second? Seconded by Representative Benham. Are there any negative votes on House Bill 79? Seeing none, we will report House Bill 79 unanimously as amended out of the House Health Committee. Thank you, members. Next on the agenda, House Bill 1104. I'm moving to re-refer House Bill 1104 to the Judiciary Committee. Is there a second? Second by Representative Rapp. My understanding is that this bill passed out of the Judiciary Committee last cycle, and those staff and committee members worked on it extensively. As they have the expertise on the issue, it made sense to send them back. Representative Rapp, did you want to add anything to that?
No, but thank you, Mr. Chairman. I do believe that this bill is better to be addressed by the Judiciary Committee than the Health Committee, so thank you.
Thank you. Are there any negative votes on the re-referral? Seeing none, House Bill 1104 is re-referred from the House Health Committee to the Judiciary Committee. Thank you, members. We have next in front of us 19 resolutions, and 17 of those are basically, as we understand, agreed to. There are 2 that have potentially negative votes on them. So I am going to move that we consider the package of 17 non-controversial amendments. Is there a second? Seconded by Representative Schusterman. The resolutions are as follows. House Resolution 46 from Representative Markozik recognizes the week of May 9 through 15th, 2025 as National Stuttering Awareness Week. House Resolution 49 from Representative Diamond recognizes October 13th, 2025 as Metastatic Breast Cancer Awareness Day. House Resolution 70 from Representative Tom Jones designates June 23rd, 2025 as Widows and Widowers Day. House Resolution 74 from Representative Diamond recognizes November 2025 as National Epilepsy Awareness Month. House Resolution 101 from Chair Rapp recognizes the week of May 11th through May 17th, 2025 as National Hospital Week. Resolution 116 from Representative Ortitai designates May 14th, 2025 as Apraxia Awareness Day. And Resolution 137 from Representative Malagari recognizes May 17th, 2025 as World Neurofibromatosis Awareness Day. House Resolution 144 from Representative Venkat recognizes April 14th through 20th, 2025 as National Osteopathic Medicine Week. Resolution 155 from Representative Maligari recognizes the week of April 20th through 26th as National Infertility Awareness Week. Resolution 156 from Representative Hanbidge designates May 2025 as Melanoma Awareness Month. House Resolution 158 from Representative Hanbidge designates May 2025 as Preeclampsia Awareness Month. House Resolution 159 from Representative Cutler designates May 2025 as Amyotrophic Lateral Sclerosis Awareness Month. House Resolution 163 from Representative Hanbidge recognizes June 14, 2025 as World Blood Donor Day. House Resolution 164 from Representative Gatos recognizes April 2025 as Parkinson's Disease Awareness Day. House Resolution 168 from Representative Labs recognizes April 2025 as World HIE Awareness Month. House Resolution 174 from Representative Struzzi recognizes July 2025 as Juvenile Arthritis Awareness Month. And House Resolution 182 from Representative Maligari recognizes June 2025 as Scleroderma Awareness Month and June 29, 2025 as World Scleroderma Day. Are there any negative votes on the package of these non-controversial resolutions? See none. These 17 resolutions mentioned above, mentioned just as we read them off, are reported from the House Health Committee. We now have two resolutions that have been asked to have a vote on. House Resolution 67, and now I move to consider House Resolution 67 from Representative Sapita Freitas, recognizing May 2025 as Mental Health Awareness Month. Is there a second? Seconded by Representative Khan. Devin, is there any discussion? Devin, will you please take the roll?
Chair Frankel,
Yes.
Representative Benham, Borowski,
Designation yes.
Boyd,
Designation yes.
Hanbidge,
Designation yes.
Howard,
Designation yes.
Khan, Kozarowski,
Yes.
Krajewski, Mays,
Designation yes.
Freelotten,
Designation yes.
Sanchez,
Designation yes.
Schusterman, Venkat,
Yes.
Chair Rapp,
Yes.
Representative Bonner, Borowitz,
Designation no.
Brown, Day,
Designation yes.
Krupa, Roy, Rossi,
Designation yes.
Stare, Twardzik,
Yes.
Walsh,
Designation yes.
Zimmerman.
Designation yes.
Passes.
The resolution passes and will be referred out of the House Health Committee. The next resolution is Resolution 151. I move to consider House Resolution 151 from Representative Parker, recognizing May 2025 as Menstrual Health Awareness Month. Is there a second? Representative Schusterman seconds. Any discussion? Devin, please take the roll.
Chair Frankel,
Yes.
Representative Benham,
Designate.
Borowski, Boyd,
Designation yes.
Hanbidge,
Designation yes.
Howard,
Designation yes.
Khan, Kozarowski,
Yes.
Krajewski, Mays,
Designation yes.
Freelotten,
Designation yes.
Sanchez,
Designation yes.
Schusterman, Venkat,
Yes.
Chair Rapp,
Yes.
Representative Bonner. Borowitz.
Designation, no.
Brown. Day.
Designation, yes.
Krupa. Roy. Rossi.
Designation, yes.
Stare. Twardzik.
Yes.
Walsh.
Designation, yes.
Zimmerman.
Designation, yes.
Thank you, members. Resolution 151 passes and is reported out of the House Health Committee. If there's no further business, this meeting is adjourned. Thank you, members.